This video will be discussing transforaminal endoscopic surgery under local anesthesia in a 34-year-old male patient who came to me with bilateral foot drop and severe pain down the left leg because of a huge disc at the L3-4 level, which had completely compressed his cauda equina. The patient did not have any urinary symptoms. However, he had a bilateral foot drop, sensory loss, and pain in his left lower limbs. The patient, when he came to me, he was walking with a high stepping gait on the left side and also dragging his right foot. Right dorsiflexion was grade 2 plus 3 out of 5, and left was grade 0 with complete numbness in both feet. We did a full volume MRI to just check for our entry points under the MRI. The entry point was taken approximately 12 centimeters from the midline, the L3-4, and the approach was from the left side of the patient as the disc was more towards the left side and he had more of left radicular symptoms. And this is a completely outside technique where we are in the epidural space. At 6 o'clock you can see the annulus, and here I'm just probing the posterior longitudinal ligament to see if there is any disc. And once we identified the disc fragment, the radiofrequency cautery was used to release the disc. On trying to pull the disc, the patient was getting pain, and hence the disc was released further from all sides, and then the fragment was removed in totality. One huge fragment was found. The fragment was measuring almost 5 centimeters in length, and the minute the fragment was removed, the patient had complete pain relief in his leg, and we can see the pulsations of the dura now, and also the traversing L4 nerve root, which is mobile. Further disc fragments were probed using Penfield and nerve hook. However, no further fragments were found. The radiofrequency was used to probe right across the epidural space, and on touching the right-sided nerve, the patient was getting right leg pain as well. So I knew that the decompression was thorough. The incision was less than 7 millimeter and no stitch was taken, and the patient was mobilized immediately after surgery. This is the patient walking 1 month post-surgery, and he has recovered completely from his foot drop with grade 5 power in both feet and no complaints of any numbness or loss of sensations.
Hi, I had a foot drop and I got operated by Dr. Sambhav Shah on the 1st of September 2018. It was really painful and I couldn't walk at all, and there was no other way except surgery, which he advised me to go through. And post surgery, he had assured me that I'll be able to walk within a day, but I could actually walk in 30 minutes after I came out of the surgery. During the surgery, I had a local anesthesia, so I was awake throughout the surgery, but there was no pain. It went through very well as he had told me it would, and I'm extremely thankful to him for making this so easy for me, which I thought would be a nightmare. Thank you very much.